waiting for Professor Vile. And we don't have any way to communicate with him. So I think Saurabh only knows how to communicate with him. So can I have the WhatsApp number of US guy who is coordinating? I don't know. I don't have the US guy number also. Sir, we are just waiting for Professor Vile, sir.
No, I know what is the plan like, Nitin?
So, sir, like There was some. Are we live now?
Yes, sir. Yes.
Dear delegates, Professor Will had some emergency or something like that, so he's not available. And this session we have to reschedule, and it would be informed. Probably we are going to arrange this on 5th. We will update you about the final timings, and Khurana sir and Praveen sir will also be there for the same thing. And I'm really sorry for this inconvenience to you all. Thank you, everyone. Thank you, Khurana sir. We are really sorry, sir. We could not.
There's no problem. We understand because he's a practicing obstetrician as well. And even though he's always given us the final word of ultrasound and obstetrics and gynecology, we are willing to wait for him because he's a great mind. You see, he was the first person to give us the concept of changing obstetrical ultrasound to ultrasonographic obstetrics, where you and me realized that we are in a position to actually guide every single obstetric decision apart from when the sperm is going to meet the ovum. Everything else is ultrasound guided today. And I really look forward to him whenever he's available for us.
Yeah. And, I would really want to hear in just in brief, though we are going to listen to him. But what is your experience regarding fetal AI so far?
Yes. So, you see, unlike everywhere else, where we have sort of tried to do something, pretending that we're achieving something, in artificial in intelligence in radiology, we've actually achieved only two things. One is a terrific analysis of chest X-ray, where we've seen lesions, and the second thing is bringing the radiology test to the top of the file because radiologists are so busy they don't understand which scan needs an urgent report. So in CT and in MRI they shift anything with the finding to the top of the file. In ultrasound, however, we have made some tremendous progress. And the first two really large pieces of progress we made were, the first one was where we did realize that you and me and our eyes cannot see whether a lung is mature at the end of pregnancy or not. And we do understand that if we repeat a dose of steroid, we undergo a much higher risk of growth restriction, adrenal failure, and necrotizing enterocolitis. So we don't want to repeat an antenatal steroid. And yet we want to know, is that lung ready or not? And machine learning taught us that if we send a 4-chamber view of the heart and include the thorax, and we send it across on broadband, we get an answer whether the lung is mature or not. The second thing we've learned, which is already in clinical practice, is the fact that if you and me send a longitudinal evaluation of the cervix at 22 weeks, I'm able to know by artificial intelligence that this is a cervix that is prone to preterm birth, where the prediction is far superior to cervical length alone and to elastography. Of course, these things are already commercially available. So those are the two that are already in the realm of being commercially available. Then, of course, we've had software on equipment where, for instance, we highlight a fluid area with color and we say this is fluid and we get an excellent idea about follicles, about masses, etc. That is pure software. I won't call that artificial intelligence. It just helps us. What is perfect is what has been introduced by ultrasound machines this year. And that is that while I'm scanning, my ultrasound scanner tells me that this is a perfect image for your abdominal circumference measurement. It's able to identify the spine, able to identify the stomach and the portal sinus and say, yes, this is my section for the abdominal circumference. It does exactly the same for the cranial parameters and it does exactly the same for femur length. While I'm going on, the equipment makes sure that I freeze where the face is ideal. For instance, the nose lips view. It says nose lips view. Orbits, it says orbits view. And then it ticks them off on a list. So I know that my list is complete, that I'm being assisted. And therefore my performance is that I will not miss anything. And the machine assists me in becoming intelligent. Therein lies the future. We have done a lot of this work in India already. And part of it that we did was also, in addition to this business of making the list and the machine intelligent, we sent data, and all of this came in through Oxford. We sent some data also on now being able to recognize on the basis of a scan done by a new sonographer, that means a new person who's got into ultrasound, where he just sweeps across the abdomen or she sweeps across the abdomen, the machine in Oxford is able to look at this and tell me two things very clearly. A, is this breech or is this not? And therefore, does this girl need to be transferred to a hospital for an operative delivery? Second, is there a significant placenta previa or not? And does it come into the lower segment? And therefore, should I consider transfer to a secondary or a tertiary hospital? So these are the kind of solutions that we're looking for in artificial intelligence. They're already here today. And the third thing is, of course, is what I call radiomics. We have metabolomics and we have genomics. Today, we now have radiomics, that a feature that I see on ultrasound will be incorporated into an algorithm. And that will tell me very clearly that, yes, this is the influence of my radiology finding on the outcome in this fetus. Fantastic. What we've also done is some great stuff on putting on my machine all the Mullerian abnormalities according to the Escher classification. And Dr. Thielen Praveen has worked hard to also put an IOTA on our machines. He's put an IETA on the machines, the infiltration of endometriosis. All that is now on the equipment already. So in ultrasound and obstetrics and gynecology, artificial intelligence is a reality, unlike everywhere else where it is just a minor facilitator. For us, it's become a prime mover. And I really look forward to next week's talk.
So maybe for Mullerian anomalies also, we can use all these things.
It's excellent. It's already there. It helps us identify the anomaly, and it tells you to fill in that last box in case it's a different one, because we know that they're newer anomalies.
U6,
and it's there on our equipment already, low end and high end.
We would like to hear from Praveen sir also. Sir.
Basically, what is happening is ultrasound is one of the most used modality in medical field, more than the CT and MR. What is happening is ultrasound has got images which are not optimal, in the sense there is low image quality, and there is a lot of inter-observer and intra-observer variability. These things are the ones which have to be corrected or to be rectified or standardized in order to come to a diagnosis. So that is the reason why they have been acquiring a lot of data, normal data, and this data has been compiled, and using this data, now they are comparing with the abnormalities. So taking all these components into consideration, what they have done is what is called as deep learning or machine learning, wherein this data that has been acquired is used for various applications. As Ashok has already told us about the planes that have to be evaluated, the cervix that has to be evaluated to say whether it is a short cervix or not, or a premature delivery or not. And not only that, the biometry. And now they are now trying to compare normal planes. For example, as you see, you have seen in the morning, Dr. Ramurthy telling us about the 3 basic planes of the central nervous system. Now they have compiled a lot of data acquired on this particular aspect into a lot of computers, where they have used that data to identify the image that you have taken, whether it is correlating. That is, the pattern recognition has been being trained. The deep learning has been, the machine has been trained to identify by what is called as CNN, convoluted network. So this is the one which is going to help us in identifying various abnormalities. And I think that is where his talk particularly is so very important in syndromes, because syndromes are the most complicated situations where you have various things where your mind has to work on to say that all these findings put together is what a syndrome is. Which, if someone can help you, the artificial intelligence or deep learning can help you, that makes our life much more comfortable. I think that is where we are going to use, and ultrasound is one area where deep learning has been really going to be useful. And we have to learn making use of this artificial intelligence. We cannot get away from it. And it is not a competition for us. It is actually a felicitator for us. That is most important thing that we should, because we should not shun away. We should not have a negative attitude towards artificial intelligence. Not that is going to take away our bread and butter. It is going to make us much more intelligent, much more comfortable, much more user-friendly. So that is what we have to make use of this particular artificial intelligence or deep learning. Yes, Ashok, anything more?
I fully agree with you. It's no question of offering any competition or putting us out of a job. it is making our jobs easier. We will learn to use our talent and our mind and our time more intelligently by using artificial intelligence. It is no threat to an intelligent practitioner.
Right, Nitin. So shall we leave the meeting?
Rightly said that it's not a competitor, rather it's helper. And briefly, really, we had a fidelization without Dr. Will also, but definitely we are looking forward for his session on the coming Saturday. Thank you
Yeah.
so much for your time, sir.
Thank you. Thank you very
Thank
much.
you.
Bye. Good night.
Good night.